Mariah. I'm going to be your student nurse today. Before we get started, can you just tell me your name and your date of birth, please?
My name is Josh Birch, birthday 10/23/91.
Okay, and then your medical record number?
So 555-555.
Okay, wonderful. So that all matches your wristband there, and it looks like it also matches your chart here. Now, do you have any allergies to food?
No.
Medication?
No.
Latex?
No.
Tape?
No.
Environmental?
No.
Okay, great. So that all matches your chart and your wristband. Okay. And I do have your vital signs here. Looks like your heart rate's at 72, your blood pressure at 125/70, your respiratory rate at 15, and your oxygen saturation at 98%, and your temperature at 98.6. So those are all good and within normal limits. Now, do you have any pain today?
Yeah, my knee.
Okay, when did it start?
It started last night.
And where at in your knee?
It's right by my patellar tendon.
Okay. And what does it feel like?
It's just like a throbbing pain.
Okay. Is there anything that makes it worse?
When I walk and put pressure on it.
Is there anything that makes it better?
When I'm off of it, sitting down.
Okay. Have you used anything to treat it?
It's just over-the-counter pain medication.
And on a scale of 1 to 10, how bad does it feel?
So about 8.
Okay. All right. And I do just have to assess your level of consciousness. You have to tell me your name and your date of birth. Can you tell me where you're at right now?
I'm at a doctor's office.
Okay. Today's date?
On the days to 12.
Okay. And what you're doing here?
Get my knee checked out.
Okay, so patient is alert and oriented to person, place, time, and situation. And I do see you have some equipment here, so I'm going to check out your nasal cannula. Okay, I don't see any skin breakdown there. I'm just going to follow this tubing. There's no kinks, and it is the appropriate flow rate. And you also have an IV here. Do you feel any tenderness?
No.
All right, I don't see any skin breakdown or lesions there. I'm also going to follow this tubing. There's no kinks there, and it looks like the appropriate flow rate that the doctor ordered. And I don't see a catheter, but if I did, I would assess that appropriately. Now I'm going to check on your hair. All right, so your hair looks even. I don't see any rashes, skin breakdown, or lesions on the scalp. I'm going to feel your skin. Your skin is warm and dry. Good elasticity in your skin turgor. And I don't feel any edema in any of the extremities. And can I see your nails? All right, your capillary refill is less than 3 seconds there. And less than 3 seconds there. Okay, I'm gonna check your ears. There's no drainage, skin breakdown, rashes, and no drainage, skin breakdown, or rashes in that ear either. And I'm going to assess your eyes. Can you follow my pen light for me? All right. And can you put your hand up, and I'm just going to shine the light to assess your pupils. Okay, so your pupils are equal, round, and reactive to light and accommodation. Your sclera is white, and your conjunctiva is pink and moist. All right, I'm going to check your nose. I don't see any drainage, skin breakdown, or lesions there. And can you open your mouth for me? All right, and your oral mucosa is pink and moist. I don't see any redness, sores, or lesions there. Okay, so now I'm going to assess your smile. Can you smile for me? Okay, and everything looks symmetrical there. I'm going to assess your breathing. It doesn't look like you're using any accessory muscles for breathing. I don't hear any labored breathing. And your chest wall. Your chest wall is equal bilaterally. Now I'm just going to have you turn around. I'm going to listen to your lung sounds. And when I touch your skin, if you could just breathe in and out for me. All right, very good. So that sounds clear. All right, you can turn back around for me. Now I don't see an incentives barometer, but if I did, I would teach you how to use that. Okay. So now I'm going to feel your pulses. So your carotid pulse. Very good. All right, very good. I don't feel any thrills there. And your radial pulses. Very good. And your pedal pulses. Okay, so all of your pulses are equal bilaterally. Now I'm going to feel your PMI. Alright, so that feels good. I don't feel any thrifts or heaves there. And I'm going to listen to your carotid pulse. Okay, that sounds good. I don't hear any bruits. Now I'm going to listen to your heart sound. So I'm going to start with your aortic on your right sternum border on the second intercostal space. Then I'm going to move to the pulmonic on the second intercostal space on the left sternum border. Then I'm going to move down to Erb's point in the third intercostal space on the left sternum border. Then I'm going to move down to the tricuspid in the fourth intercostal space on the left sternum border, and down to the fifth intercostal space in the midclavicular line for your mitral. And then I'm going to listen to all of them with both my bell and diaphragm. Okay, so that all sounded good. Regular rate and rhythm with no extra sounds, and both S1 and S2 were present. Okay, so now I'm going to just assess your extremities. Do you feel any tingling or numbness in your extremities?
No.
Okay, can you grasp my hands for me? Okay, so there's equal strength bilaterally there. And then I'm going to assess your dorsiflexion and extension. If you can put your feet up and point your toes to the ceiling. All right, and then try to resist me. Okay, very good. And now point your toes down like you're pressing on the gas and try to resist me. Okay, so both of those are present and you have equal strength bilaterally.